as always, and today we are going to be talking about the human brain. Now, as we talked about a couple of weeks ago, the human brain is fascinating and wonderful in the fact that it has and maintains neuroplasticity. When your focus is on the depression that you're feeling, the anxiety that you're feeling, the PTSD that you're experiencing, your brain tends to respond by actually decreasing the connection, the communication in those areas. It's no wonder that those areas of the brain are not working. They're broken. This is why sometimes your thinking may be a little bit flawed. You may have trouble making decisions. Your personality may be affected. Your impulse control may be affected. However, what's really encouraging is we now know that medications, therapy, and treatments like TMS and ketamine infusions can also reverse that. Your brain can reform connections and can rewire pathways to help you regain control of those higher level prefrontal cortex functions. Now, one of the ways that we've been able to show this or actually visualize this is through what's called SPECT imaging. Now, brain SPECT imaging is a tool that we use to visualize blood flow and activity level in different regions of the brain. Now, this allows us to see areas with healthy activity and healthy blood flow versus areas with poor blood flow and either too little activity or too much activity. So now we're going to look at some slides of images of a healthy brain versus brains that have been affected by ADD, anxiety, depression, and PTSD. Now, the majority of these images have come from the work of Dr. Daniel Amen, who has really helped to expand SPECT imaging. Okay, as you see here, this is a healthy brain. The surface of the brain looks smooth, and you see full and complete blood flow and activity. This next slide is an unhealthy brain. As you can see, there are a lot of holes on the surface, which show areas of low blood flow and poor activity, and that's because of damage. Now, here we're looking at a brain that's been affected by pure anxiety. And as you can see, in an area called the basal ganglia here, there is way too much activity. And as Dr. Amen says, this person's brain is set to too high of an idle. Now, here we have pure depression, and what you're seeing is far too high of activity deep in the limbic system. Now, that's your brain's emotional center. This is a really interesting pattern, and this is indicative of unresolved trauma or PTSD. And again, this is the same kind of thing you might see for people, certain patients experiencing anxiety and depression or addictions. And finally, here are sets of slides comparing depressed brains before and after TMS and before and after ketamine. Notice the improved perfusion and brain activity in both sets of slides. Okay, all this is fascinating, right? It's all great. How cool that we can actually see pictures of the activity level in people's brains. But what does that mean? Now, why even talk about this today? For me, it's really important to share with you the fact that depression, anxiety, PTSD, these other issues, they're caused by actual issues with your brain. Now, they're not due to some sort of personal weakness or any other thing besides a physiologic dysfunction. Now, if your arm was broken and you could actually visualize it in an x-ray, you'd go and get help for it. What's great about living right now is that we're actually able to start seeing imaging, to start recognizing that mental health is a physical problem and needs to be addressed. What's also great is that now we know that things like therapy, antidepressants, ketamine, TMS can all help. Now again, the human brain is so complex that we don't always know that it's going to treat everybody. But for people that are out there suffering right now, it's a place to start. And what our goal always is to help people just get that initial push to help make themselves better. And as you can see from these images, the pain that these patients are experiencing is real. And it's due to a physical problem. A problem that in many instances can be treated. Now if you like what you saw, click like and subscribe below. And I'll see you next time.